Hi, my name is Morgan Mannion. I am going to administer drugs to my patient. First, I'm going to kind of go through my CG wiper and my pre-procedural steps. So my patient needs some different medicines. So right now I'm at the Pyxis. I'm checking medical records and I'm gathering information that my patient needs. This patient is going to be given an IV piggyback, an IV primary, and then one subcutaneous heparin, one injection of vitamin B12 intramuscular, and then 2 medicines by mouth. And in this case, this patient has a temperature of over 101. So the patient's temperature right now is 101.5. Their blood pressure is 142 over 84. Respirations are 22. Pulse is 92. Pulse ox is 97 on room air. So again, I'm at the Pyxis. I'm gathering my supplies. I'm making sure there's no allergies. I'm double checking, especially the heparin. I'm going to have another nurse double check the units I have there. And I'm doing my CG wiper. So I've performed my hand hygiene. I'm going to put on my gloves. They're very small. I'm providing the patient with privacy. I'm going to raise the bed as well, checking again her medical records, if they have any history of allergies, any physical conditions, anything like that. So I've gathered all my medicines here. I have acetaminophen or Tylenol. I'm giving her 650 milligrams, again, because her temperature is over 101. So this calls, she needs 650 every 4 hours if her temp's over 101. So I'm going to give her 650 milligrams of acetaminophen. I'm not touching anything, and I'm just putting the medicine in the cup. And then she's also getting one other medicine by mouth. All these medicines are at 0900. She's getting Atenolol, 100 milligrams by mouth as well. I'm putting this also in here. Again, not touching anything. So I have her medicines by mouth ready. Now I'm going to get her IV piggyback and her primary hooked up in her room. So I'm going to again come into the patient's room. Her primary solution is going to be her normal saline for hydration. She's getting 75 milliliters every hour, and then her second medicine, which is her secondary, that is what's raised at the top here on her IV. And she's getting 500 milligrams of that over 30 minutes. So I'm coming into the patient's room. I've got medicines. Hi, how are you? I'm Morgan.
Hi.
How are you feeling? Okay? So I'm checking, you're sick, we're going to take care of you. I'm checking her her ID and her form twice, making sure it's her. I'm making sure she's awake and oriented. Again, I'm raising her bed here. We're going to give you some medicine. Do you have any allergies to the medicines I'm giving you? Okay. So again, with the medicines, her getting more than one medicine, I'm definitely going to check and assess for allergies, make sure she doesn't have any allergies that she knows. So I'm going to give you an IV for hydration and then your antibiotic as well, okay? So first I'm going to set up the primary, which is the normal saline. So I've taken my alcohol swab and I'm wiping all of this and everything where I am injecting and connecting for sanitation. Okay. So I'm taking off the cap and I'm hooking it in to here. I'm hooking it into here. Just kidding. What am I thinking? Okay, so this has to go in pretty far to make sure we can get the IV out. So it's gonna go past this point. So I have this locked here, but I'm gonna squeeze this, and again, I've cleaned everything. I'm gonna squeeze this, and I wanna make sure that there's no bubbles. There we go. So it's running through, we're gonna make sure there's no air bubbles or anything here. So after this one is done, so this is her primary, so this is where she'll be hydrated. And obviously, if this was a real scenario, this would be hooked up into her. So her secondary is always gonna be higher than the primary. Her secondary is her antibiotic. So again, I'm wiping all of this down. And again, I'm going to take this off. Hook it in. Again, these are kind of, you have to make sure that they go in. Also on this, I will make sure that these are marked, signed and date, when it was administered, the time, and how much she's getting and whatnot. For myself, and then for the next nurse coming after me. So I'm hooking up her secondary as well. So again, I'm gonna pump this. I need to go actually a little bit higher on it. Let me go a little bit more. I think I got it now.
Okay.
All right, so now this is going again. I'm gonna clear this. Make sure there's no bubbles. Now I'm going to connect the two. Like, where is everything at? So again, I'm swabbing all of this with my alcohol, connecting, labeling. She's all good to go on her IVs. All right, so your IVs are done. So would you prefer I give you your medicines by mouth, or you have to give you 2 shots? Which would you prefer first?
My medicine.
Okay, by mouth?
Yeah.
Okay, so I'm gonna give you, since your fever is a little high, we're gonna give you acetaminophen or Tylenol, 650 milligrams every 4 hours as you need it for your fever, okay? It'll reduce your fever, and then you're also gonna get your Atenolol, 100 milligrams right now as well, okay? So the pink is your acetaminophen, and then your Atenolol is the white, okay? She has water. I'm making sure she is obviously propped up in the bed. She's taking these by mouth. I'm gonna make sure and watch her take by mouth. You're gonna swallow with water, all that good stuff. Okay, so now I'm going to give her 2 different injections. So you are going to get heparin sodium, okay, 1,500 units at 9 o'clock, and then again at 8 o'clock, subcutaneous, okay? So would you prefer your stomach there, and then your right or left side?
Right.
Okay, so your right side. So for her heparin, and then again, I'd have a nurse double check the heparin. She's gonna get 1,500 units here. So